Hello everyone, today we are going to talk about clinical psychology, its definitions, and its history. Please turn on your captions if you have any difficulty following along, and let's get started. So now you can see the official definition of clinical psychology. You can pause and read it out for yourself if you want to, but I'm going to focus on the idea that clinical psychology is both a science and an art. While it is important to use the scientific method to develop standardized procedures and tests, it is also important to note that a psychologist has to determine which tests and procedures will suit the patient in question. People with similar problems may not respond the same way to the same tests, so there is a great deal of subjective assessment going on from a psychologist's point of view. Contemporary clinical psychology follows an eclectic approach, which means that it does not subscribe to a particular theory. A more holistic model, known as the biopsychosocial model, is followed in clinical psychology today. The biopsychosocial model states that mental illness can be a result of biological factors, psychological factors, and even social factors. But more often than not, it's a mix of all three. A person's life is interconnected. Thus, a bad day at work can affect one's neurochemistry and make them insomniac, which may then lead to a stressful experience. This was not always the case. For example, let us look at the Greeks. Greek philosophers believed that the mind and body were interconnected and thus mental illness had spiritual causes. It was common to see insane people meditating and spending time at temples. Hippocrates believed that an imbalance in bodily fluids called humors was responsible for mental illness. The four humors were black bile, yellow bile, phlegm, and blood. Excess of any one would cause a different disorder. Too much yellow bile would make you choleric and lead to you being very angry, while an excess of black bile would make you melancholic and lead to you being sad all the time. Plato believed that mental illness was caused because of man's ignorance of himself and problems in logistikon, the part of the soul which occupies one's head. Aristotle believed that emotional states such as happiness and anger determine mental illness. He believed that talking logically to a person with mental problems would be helpful. Galen was a believer in induced vomiting and even bloodletting. He believed that humans have a main soul which is located inside the head and a subsoul which may be in your heart if you're a man and in your liver if you're a woman. But to Galen, the soul was a slave and not the master of the human body. In fact, mental illness to Galen was caused by the wishes of the soul. The Middle Ages saw a complete revival of supernatural practices which involved belief in witchcraft and sorcery. There was religious fanaticism all around, since medical science had not developed enough to explain the causes of the plague. For example, there was still some hope because of people like Aquinas who believed that the soul cannot be sick and hence the source of mental illness must be physical or the fault must lie in one's reasoning and passion. Paracelsus, on the other hand, believed that the arrangement of the stars and the planets affected one's mental health. Even at times like these, people like Vives and Ware were trying to humanize the treatment of the mentally ill. Renaissance period saw a rise in ultra-rationalism, where everything which could not be seen was rejected. People now focused on their life rather than worrying about what happens after death. René Descartes believed in mind-body dualism, which stated that the mind and body were independent of each other. There was a development in the physical treatment of mental illness, but it was far from scientific. It included extreme forms of torture and neglect. In fact, the English word bedlam, which means chaos, comes from the word Bethlehem or St. Mary's Bethlehem, which was opened in London. Their treatment included starvation, cold water dunking, restrictive cells, and bloodletting. In the 19th century, Cartesian dualism began to fall apart. Rush, who authored the first work on psychiatry in America, believed that mind could cause diseases as well. Mesmer realized that there were some patients who had paralysis and blindness but had no accompanying physical pathology. Martin Charcot used hypnosis to cure paralysis and blindness when there was no apparent cause. Pinel developed the moral theory which talked about maximizing the welfare of the patients and decided that they should be properly looked after. His ideas were followed by Ellie Todd, who incorporated them in Hartford, Connecticut. People such as Emil Kraepelin were studying and describing schizophrenia, although the schizophrenic attack has dementia precox. Kraepelin believed that the mental illness was caused by problems in the brain and they can have an exogenous, external, or an endogenous or internal reason. In 1892, the American Psychological Association was set up. There were many active psychologists at that time, such as Galton, who was interested in lab experiments, and Cattell, who was studying individual differences. Dalton was actually a relative of Charles Darwin. Till now, psychology was more academic centric and not applied in any sense. When Leitner Whitmer tried to open a psychological clinic at University of Pennsylvania in 1896 after successfully treating a child who had problems in spelling, reading and memory, he was not supported by his colleagues because they wanted to study the brain and the mind rather than actually helping someone with their knowledge. Before long in 1904, University of Pennsylvania started teaching clinical psychology thanks to Whitmer. In 1885, Alfred Binet set up France's first psychological lab. In 1904, he and Simon were approached by the French Commission to develop tests which would point out kids with special intellectual needs. They developed this Binet-Simon test by 1908 and was brought to the US by Goddard. Terman, who was a psychologist at Stanford, revised the test and labeled it Stanford-Binet test. These tests became an extremely popular way to help children in their education across the country. Clifford Beers was a former mental health patient who wrote a book called A Mind That Found Itself in 1908, complaining about the horrific techniques used by mental asylums. He gained the support of Adolph Meyer and William James while advocating against the inhuman treatments and would later go on to lay the foundation of National Committee for Mental Hygiene, which then became National Association for Mental Health. This movement persuaded William Haley to open the Juvenile Psychopathic Institute in 1909 and established child guidance centers across the country which would pick out kids with delinquent behavior and try to intervene as soon as possible so that the conditions can be reversed. He was different in his approach from Whitmer, since the latter focused on intellectual abilities of children while the former focused on behavior. Finally, who does not know about Freud? He had a holistic and Greek-like approach towards psychology, but he was not much famous in the US till 1909 when he was invited by Stanley Hall, who was the first president of American Psychological Association, to mark the 20th anniversary of Clark University. The celebrations included people such as Jung, Tishner, and William James. People interacted with Freud for the first time in US and his lectures gripped them. His psychoanalytic theory was then used in child guidance centers across the country. All of this laid the groundwork of what we now call clinical psychology. That's all for this one, guys. I hope you enjoyed this video. Don't forget to like, subscribe, and comment on this video. See you next Monday.